Welcome everyone to the Ontario Caregiver Organization's webinar series. These webinars bring together caregivers and subject matter experts to explore topics of interest to caregivers. We do this to support and engage chosen family, friends, neighbors, really anyone who's caring for someone else. My name is Katie Muirhead, and I'm going to be your moderator for today. We begin this gathering by acknowledging the Indigenous peoples of all the lands that we're on today. And while we meet on a virtual platform with people joining us from across the province, I'd like to take a moment to acknowledge the importance of the land we each call home. The land that I'm standing on is the traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples, and acknowledging this reminds us that our great standard of living is directly related to the resources and friendships of Indigenous peoples. As team members at OCO, we are learning about the lands from which we work and exploring how we can be meaningful allies and how we can support the recommendations from the Truth and Reconciliation Commission. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our understanding of local Indigenous peoples and their cultures. We invite you to take a moment to reflect on the land where you are. And if you're not familiar with that, we will be sharing an interactive map that tells you which traditional territory your city or town sits on. And you can find that at native-land.ca. Our webinar today is called Grief, Facing Illness, Death, and Other Losses. Grief and loss can be a lonely and isolating experience. As a caregiver, you may encounter grief at different points on your caregiving journey. In recognition of National Grief and Bereavement Day, we welcome back Dr. Patrick McGrath and Brianne Ling to talk about different kinds of grief and the emotions that come with it, what you can do to understand the grieving process, and tips on how to cope with grief and loss. Dr. McGrath is a clinical psychologist and emeritus professor of psychiatry at Dalhousie University and a scientist at the IWK Health Center, where his research is based. He's an adjunct professor of psychiatry at the University of Ottawa and founder and president of 90-Second Health Letters. Brianne Ling is a registered psychotherapist in Ontario and Nova Scotia with a master's degree in counseling psychology and is certified in Level 2 Cognitive Behavioral Therapy, or CBT. Since January of 2021, Brianne has also been a peer mentor with us at OCO, and she assists with the Young Caregiver group. And she was a primary caregiver for her parents who had both battled cancer until their passings. So welcome, Dr. McGrath and Brianne.
Thank you very much. I should tell you a little bit about my own experience with grief. I had a son that died in infancy many, many years ago. And then more recently, my wife died after I was caring for her with cancer. And that, combined with the academic and clinical preparation that I've had in grief, has made grief a very interesting and very important part of almost everybody's life, especially when you reach my age. We all have experienced quite a bit of grief, and grief knows no boundaries, and it's important, I think, for all of us to understand it. Brianne?
Yes, thank you, Dr. McGrath, and thank you, Katie, as well. Like Katie had mentioned, I was a young caregiver, unknowing. I was not aware of it at the time, but since about the age of 6, I lost my mother when I was 21, and then was more of a primary caregiver for my father from 22 until his passing when I was 26. And I found OCO in 2021 and was just elated that there was a word, not only a word to define what I had gone through, but also a place for other caregivers to get that support. So I'm a peer mentor and also run the Young Caregivers group. And we're today going to be presenting. So I'll let you start, Dr. McGrath.
Well, let's go to the next slide.
Sure.
So I think the journey that we want to go on today is to talk about what is grief. We want to talk about Kubler-Ross and grief because she's been such an important influence on how people think of grief. And then we'll talk about normal grief and what we call the dual process model of grief, a model that I found very helpful. Issue of avoidance of grief and then interventions for grief. We're not going to tell you about medical, how to deal with your own grief in particular. This is more of an information session. And if you need specific help, you probably should talk to your family doctor or other medical or healthcare provider. Thank you.
Awesome. All right. So starting with grieving. So oftentimes we do tend to think of grief as with association of a loss, the death of somebody close to us. But grief can also present itself in many different areas, such as a loss of a major function, loss of a job, loss of a baby, a miscarriage, a loss of the plan to have something. So when we tend to think of how our life will unfold and it doesn't go that way. So loss of a status, estrangement, loss of a dream, death of a parent. So there's many different areas for grief. So what is grief? Grief is the response to losing someone or something that you form an attachment to. And following a loss, it does leave effects on us. So we are going to experience emotional effects. We are going to experience cognitive as well as different behavioral effects. And this is very common, although it can definitely not feel very nice because it is something different. So a lot of us who are here today, caregivers, we've all experienced this, and it is we often have time to get ready for a loss, get ready for a death. And during that period of time, what we call that is the anticipatory grief. So that would be before the death or a loss of something. So we might know that it's coming. And this will also cause us to have different emotions, cause us to feel confused, question ourselves, others, the world. And so, during that period of time, while we know it's coming, there are typical responses. We might not want to think about it. And it's important that we can consider the time we do have now. That is one aspect that we can look at and what we can do for ourselves in the remaining time. Grief does happen in young people. Young people do experience loss, and it will present in the same ways. It can be a little bit more intense, but also a little bit more internal, and it might look different because maybe young people haven't learned how to express themselves or what they're experiencing or know what they're experiencing. So oftentimes we can see acting out or changing in our eating patterns, withdraw, or extra clinging to people. Can also be not talking, or an intense preoccupation with what did happen, trouble focusing, distracted.
So I mentioned before that Elizabeth Kubler-Ross, and she died now in 2004, almost 20 years ago. She was really a pioneer in talking about grief and talking about bereavement. And she had a tremendous influence on the field. She did propose a stages form of grief. And she said that grief and bereavement goes through different stages, starting off with denial, anger, frustration, depression, and so on. So that the thing is that then bargaining, and then finally coming to acceptance. So it really was a staged approach. All of these things happen, but we found out since Kubler-Ross first proposed these, that they don't follow a nice staged model. And some people may not feel some of these things, and that's okay, because it was a very good model to provoke discussion, to really give us an understanding that grief was important, that bereavement was important. And so that's the role that Elizabeth Kubler-Ross played. Next slide. And so it opened the door to discussion about grief. And prior to that, there was a lot of denial about death and bereavement and grief. And it really just allowed people some framework to be discussing it. Now, the problem is, of course, is that if we take her model too literally, we can be confused by it. Grief doesn't follow specific stages. Some stages may be lacking and they may occur in different orders. Some people get stuck at one point and not at others. Sometimes things, anger, for instance, may come, then it may go, and then come back again. So more than one of the same stages may be occurring at the same time. But Kubler-Ross, to her credit, never said it was a given set of steps, but sort of like her people afterwards began to think of it almost as it was written stone, and that's not accurate. There's no normal amount or time for grieving. I think that's one of the most important messages that we can get across. Culture makes a difference. For instance, in the Jewish faith, there may be Shiva the first 7 days, and Shlosh, I'm sorry, my pronunciation may not be right, in the first 30 days, and then an anniversary of the death every year. So there may be cultural norms in our culture or in our religion that help us put some structure to it. But the definition of normal grief varies a great deal. And we like to say that there's no such thing as normal grief. There's just grief that you can cope with, or at times there's grief that is so hard to cope with that maybe something has to be done. For example, Queen Victoria, she had, that's a picture of her, and dearly beloved Queen reigned in the UK and in Canada, of course, for a long time. But her husband died, Prince Albert died, and she stayed in grief and in mourning, dressed in mourning clothes for 40 years. And for most people, grief isn't going to last that long, although we all have grief at different times. So, for example, with my own son that died, several decades ago, whenever the anniversary comes up, that's a somber day for me, a day to reflect. So maybe you could share a question or comment. We'll just take a second here, put it in the chat box. What is normal grief for you? What's been your experience with what you would call normal grief? We'll just take a minute now to do that.
And while you guys are typing, I can share, I'm actually upcoming on a 12-year anniversary for my mom. And it's interesting because at the beginning, it was quite somber, like you mentioned, Patrick. And over the years, I have noticed myself shift into what I do on that day. And I look forward, actually, this coming Saturday when I celebrate 12 years, celebrate the life of my mother. And I'm going to a show, and we'll be able to think of her fondly and remember her.
And I think that's a really important point. We all have different ways, and they change.
They do change.
They change, and they should change because we change. And we may choose to move from very somber to more joyful, or maybe we want to reflect more because of other events in our lives.
Absolutely.
And none of these is wrong. Nothing is pathological like that. It's just the way we are, and we should learn to accept and celebrate the way we each deal with grief.
Absolutely. I like to say there is no rule book. I'm seeing some of the comments come in. Oops, I will. What we're seeing definitely comes in waves, roller coaster of emotions. They're coming in. They're coming in quick. Okay. It is personal. Yes. Yes, shedding tears over memories, absolutely. Moments of deep sadness returning unannounced, and then it passes. Grief can happen several years after a person that you love has died. We will come to that, yes.
So maybe we should go on to the next slide.
Absolutely.
You keep on sending in your notes. There's a model of grief by two researchers, clinicians, Stobe and Shute. They talk about grief as a dual process model. And I really like this model because it makes such sense and it gives us a direction to go when I'm working with people with grief. It's not a stage model, but rather a process model. And it suggests that there are two processes that go on at the same time, sometimes in parallel, sometimes mixed together in different ways. One of those processes is grief for the loss, okay? Feeling sad, feeling upset, feeling that life is difficult. But the second is engaging in future-oriented activities or a restoration. And so these two processes go along at the same time. And sometimes they're in parallel, sometimes one is dominant, sometimes the other is dominant. And what we see that we oscillate in these two processes. And that's a very important thing to think about. It doesn't have to be all one or all the other. It's both processes are important for resolution of grief. If we deny the grief, we won't make progress. We'll just get stuck if we pretend it isn't happening. And in the loss-oriented, we do grief work, grief intrudes, we change our bonds with people, we may change our relationships, and there may be some denial or avoidance of restoration, of being normal again. But in the restoration-oriented side, we attend to life changes, we do new things, we distract ourselves from grief. We, in some ways, even deny a little bit of our grief. That's okay. And we get new roles, identities, and relationships. And these go back and forth, back and forth, back and forth, not just for a few weeks or a few months. They go back and forth for the rest of our lives, for a profound loss that we've experienced. And sometimes over time, that the grief side will be very small and the loss side will be small, and the restoration side will dominate. And then some days, as I mentioned, when the anniversary of my son's death comes up, well, it's really the loss-oriented that seems to dominate for that day. But then quickly, it's going on to the restoration-oriented. And then I pay attention to my daughter, who was born long after that. I pay attention to my new friends, things that have happened, and so on. So this dual process model is great because it provides guidance for supporting people. We can support people in their grief. It's okay to be upset. Crying is normal. We can encourage support by others. We can discourage avoidance of grief if it goes too far. This is all a matter of judgment. And in the later stages, after the immediate process, and usually it happens that right after a loss, there's huge domination of this loss orientation. And as the days, weeks, months, years progress, we get more future-oriented activity. And it's important to engage in both. It's not going to solve the problem by pretending grief isn't there, but it's not going to solve the problem if you don't engage in future-oriented activity. And people who get stuck in the loss, they have a great deal of difficulty and will have a lot of difficulty moving forward. There's no right pace to move forward, but we all choose what pace we want to move forward. And that future-oriented activity becomes very important. Next slide, please. So the loss dominates in the early days, and the oscillations may be very quick in the early days too. So you may go from minute to minute, and you may feel somewhat guilty about some looking future-oriented when my mother just died. So how can I look to the future? She was everything to me, but that's okay. That's the way we work. In the early days, I don't know what the early days is. Is it 6 days, 6 months, 6 years, longer? It depends on your personal situation and your culture and the way you look at things. If you're unhappy with the way you're processing, if you feel that you're processing not fast enough to future orientation, then that's something to look at. And the way to look at it is to use this dual process model and say, okay, I don't have to leave behind all my grief. I can just add in more future orientations, new things that I'm doing, trying new things, trying things that are not going to be mired in grief, but going to be celebrating aspects of their life. Next slide, please.
Yes. All right. So avoidance of grief. Everything is okay. I feel good. I have to move on. I have to continue with life. They would want me to move on. And oftentimes when we are overly optimistic, I actually just saw 90 Minute today came out. Overly optimistic can be that form of trying to avoid what we are feeling, not wanting to face the pain of the grief as it is uncomfortable. So maybe we're going to say yes to everything. We're going to not spend that time allowing ourselves to have that grief and instead just focus on future orientation of different things. And so this can contribute to prolonged grief. And it can cause irritability and burnout. And it can then appear years later. And oftentimes that can be the association of avoidance of the grief, where we will see it come out. And all of a sudden, we're fine. We were fine right after the death. We were fine a year later. We were fine 2 years later. And all of a sudden, I can't do Christmas. I don't want to decorate. I can't go to work. I can't go to the gym anymore. That is a normal process, and it can happen. Okay. So some tips on how to cope with the grief and loss. So definitely tuning into what we do need. As Dr. McGrath had mentioned, being able to have that dual process of the grief and orientation. I know early on for me, I was 21, 12 years ago, losing my mom. And so I would go out and, people know that she's dead, but they don't want to talk about her. But I needed to. And so allowing myself to bring in the loss of my mom, I talked about her and kind of brought that in, not in a negative way, but just more of a positive way in what I remembered. So what do you need mentally, physically, emotionally? It's important to have a break. It's important to ask for help. And more importantly, to accept that help, because it can be really difficult to do that. And take time to process. Doing something you love, engaging in something that even if you're not feeling that pleasure from it today, doing something that used to bring you love and joy, and that doing more of that, being kind to yourself, can help you in your process of grief. And yes, today it's not going to feel the same and it's not going to feel as good, but with more time of doing those things that you love, those can help. So another slide here. What can I do for my grief? We acknowledge. It's important to acknowledge this is a normal process. Death is normal. Loss is normal. We do experience it. So being able to acknowledge that we have lost something. And that means that there will be a change. So yeah, we do want to try to limit that avoidance, both before and after. So noticing that we're going to withdraw a little bit more, we're going to want to try to engage. It's also very important to do self-care in the sense of taking care of yourself, especially as a caregiver. We have learned that in order to care for somebody else, we do need to first and foremost take care of ourselves, accept that help, take a break, and delegate if we need to, and take some time for ourselves. And before the loss, we can focus some tips of how to deal with before the loss. It's really important. Oftentimes we can be focused on, well, what does the person need, or what do I need to do before the loss? It's really important to also consider, what do you need? You might want to say something to the person who you're caring for, but that's just not the relationship. Encouraging you to do that. Do what you feel. and what you need, and take the time to think about what you need, and choose how you want to spend the time before a loss. And then after, depending on our faith and how we grieve and our different rituals, it can be important to also consider that where they are, and yes, they're not here physically, but we can also sometimes, if we listen, we can hear. We can hear that voice. We can hear what they might say, and being kind to yourself after as well, being patient.
So one of the things that I wanted to let you know about is that we do put forward the 90-second caregiver, and that's available through the OCO. And one of the caregivers often say that they're too busy to care for themselves. And it doesn't mean that you have to take a lot of time, but perhaps part of it's going to be to look at the 90-second caregiver. And it's something that's very helpful for some people. It's free, short, evidence-based ideas about different aspects of caregiving. And there's that little squiggly box that you can get more information on it. I don't really quite understand them, but they seem to work very well.
A nice little barcode, and I think the link's there at the bottom as well.
Yes. So I want to tell you about an example of a loss. A mother, single mother, she had 2 boys, and this is a person that I saw in my clinical practice. And the older son had severe complex disorder, many problems, unable to speak, cognitive delay, and on tube feeds, lots of behavioral issues. And the younger son at home, age 12, healthy. And the older child lived at home with her mother and support from a group of paid staff 24 hours a day, 7 days a week. And she coordinated all this care. But the behavior grew worse, and during a medical crisis, became a significant safety threat. And so the child was hospitalized, and she began to feel an extreme form of grief because of the difficulty in this change. This was grief from a loss. The child was still alive and still doing as well as can be expected, but she had grief because of that difficulty getting up, crying jags, depression, negative narrative in terms of that she's saying how she had failed. If I was a good mother, this would not have happened. And she was, overwhelmed with all sorts of different things, homeschooling the younger son, applying for jobs, keeping the house clean, preparing, and so on. So here's an example of grief, not from a death, but just from a change of circumstances. And it's, the interesting thing is that our brain works so that it's not unusual, both in this situation and in many other situations, for people to walk into a room and see or sense the presence of the other person who's now no longer there for whatever reason. And that's because our brain is so used to that it fills it in. That's not abnormal. That's not hallucination. That's simply the brain filling in what the experience was. And there's some excellent books on the brain, the grieving brain, and you can understand it from a physiological point of view. You can understand it from a psychological or a social point of view. Next slide, please. So in the early days, most support in our culture comes from it's just support, emotional support, no judgment or criticism. I think that's the most, if you're talking about how to deal with somebody in grief, the best thing is not to criticize, just to support. And they may not be grieving the same way as you are, and that's okay. You may feel that, well, you should be getting out and doing things, or you may feel that, you should be more somber. You shouldn't be joking and laughing when somebody's just died, or somebody's when you've had a major loss. And then later on, maybe gentle support to begin to restore normal function. So gentle support, not criticism. Social opportunities, physical activities. I know a lot of people say, well, now that my partner's gone, that I don't get invited to anywhere. Well, because I'm sort of a fifth wheel in a conversation with other people. It's important to keep inviting people who've had losses. Keep inviting them if you had been doing that before. Return to work may occur very quickly. That's fine. Or it may take a little bit of time. Volunteer activities, the same. Other normalizing activities, again, invitations, not in veiled criticism, because everybody's different in the way they grieve. And if it's severe or prolonged, then the person may benefit from professional help, somebody who can do much of the same things, but in a more objective and more professional way. Friends often do feel uncomfortable and they avoid the topic that somebody died. And, sometimes, they don't want to talk about it. Well, then that means that person who's lost, say, a partner or lost a child or had something happen to them, or even loss of a pet. For a lot of people, losing their pet, they get grief. And that's not that, for non-pet lovers, that seems, wow, that's a bit extreme, but it's not. It's normal response. Sometimes a pet plays a major role in somebody's life. And it's okay for you to feel, to try and become more comfortable with whatever it is that their loss is. If you're feeling uncomfortable, then reflect that that's not because of their situation. That's because of your own way of thinking about loss. And so the more that you can respond to people's losses with being comfortable and accepting, and they have different ways of grieving, then that's better. After a few days or after time has passed, people continue with their life. And sometimes that's the very hard time for people who are grieving because everything else is going on. The funeral's over. It's been a month since my wife has died, then everything's back to normal. Well, it isn't back to normal for me. And maybe as a friend or as a colleague, it's important to be a little bit more supportive at that period of time. Professional interventions can occur from a psychologist or psychotherapist or psychiatrist if the grief is prolonged and severe and the person is not happy with it. I don't think Queen Victoria sought out professional help, but maybe she should have. Maybe 40 years in grieving for Albert was not in her best interest, but that's up to her to decide. And if there's a prolonged decline in function, that's the time to think, well, maybe professional help might be a good thing. It's okay to suggest this to people, but again, it's their judgment, it's their lives. And some people have a lot of grief and function quite well and want to keep it that way, and that's fine. You should get from a professional counselor or professional therapist understanding and normalization. You should get the opportunity to express yourself on what you're thinking, what you're doing, and managing body reactions. Because sometimes these bodily reactions, this fear comes very strongly, even sometime after a loss. So, for example, a person may react very strongly to some signal that reminds them or a trigger of the event. And you may get medication, and the most common medications given for grief are the antidepressant medications, and sometimes they're helpful. You don't want to pathologize a normal process, but we don't want to ignore excessive suffering or lack of functioning, and that is a balance that we have to deal with. If somebody that we're caregiving for is lost, some aspect of their life, you don't want to make it. You don't want to make it as if they're somehow abnormal because they're grieving for it. But on the other hand, you want to make sure that they don't suffer more than they need to. And there's no clear guideline to say this is when you should get professional help. There are cultural and family differences that are really, really important. If you do see that there's a severe loss of function many months after a loss, and depression and risk of self-harm for more than a short period of time, then I would think that professional help may be advised. If things go on for a long period of time, if it's been more than 6 months, say, from bereavement, and these symptoms, this is from the DSM-5, which is the Diagnostic and Statistical Manual. This is what they think is an idea of a persistent complex bereavement disorder. So they say this is a disorder. Now, I always take DSM-5 with a grain of salt. Most of these things are judgments. They're not really, they're not written in stone. But if you still have persistent, intense yearning for the person who's died, or frequent preoccupation, intense feelings of emptiness or loneliness, recurrent thoughts that life is meaningless or unfair, and a frequent urge to join the deceased in death, then I think that is time to see if some professional help may be helpful. So these are again, the criteria, because DSM-5 gives all sorts of criteria, and you can see that these feelings shocked, stunned, or numb for at least a month, intense reaction to memories or reminders of the deceased, or avoidance of reminders of the deceased, or seeking out things to try and be close to the deceased. Now, I mean, I think we all have to look at these things and say, okay, is this really interfering with my life? Is this having a real profound effect on my life? And maybe it's time for me to get some help to try and figure out, is this a bereavement disorder, as DSM-5 calls it, or is it just the normal thing in our family that we grieve in this way? And I can still do things. I can still, again, that dual process model is so important. Am I still moving forward with doing things that are engaging life as well as grief? And both of those may occur over a very long period of time. So what do we do when somebody comes to me with grief? Well, one of the first things I do is try and assess whether this is something that we should do something about. And again, that will depend on their judgment. And one of the things I want to change is help them change the narrative, the story that they tell themselves, identifying especially negative self-statements and things about how I'm to blame for this, or I should have done this, or I shouldn't have done that. And try and replace that internal dialogue with more accurate, more normalizing statements. And I think it's important to, for example, you have to identify, if I had been a better caregiver, so-and-so would have been alive today. Well, then you have to begin to look at it. Well, if it wasn't perfect, but his fall was due to dizziness. I could not be there all night to catch him. We had a deal. He was to call me or buzz me. I did everything I could. So that would be an example of then trying to replace that very negative self-statements to something like, I did what I could. And if you look at it all, I was a very good caregiver. And so that's often hard for people. They stick with one little thing. And that may have been a very important thing, but there's no way that we can be perfect in our lives. So behavioral activation, that's another side of it, is trying to deliberately planning, engaging in gradual increases in these restorative behaviors. Maybe using a schedule. Okay, I don't really feel like going out, but I'm going to go out for my walk every morning. And I used to enjoy that a lot. Got to take small steps. Maybe I won't walk as far as I used to, but I'm going to get out. Avoidance, it's really important to avoid things and saying, well, I don't want it to be normal. No, I mean, I have to engage in normal things too. You may change your roles with work or friends or family. And, behavioral activation is also a very good treatment for depression. And we get people to engage in behaviors that they may find joyful, even if they don't find them joyful right now. Physiological changes. We often get with grief an increase in the sympathetic nervous system, a fight, flight, or freeze, panic. And sometimes breathing exercises are very helpful. So deep breathing, or sometimes called box breathing, deep, slow breathing, can help you change the physiology. Physical exercise is really good for that too. Moderate physical exercise, not going crazy about it, but just moderate physical exercise. Using yoga is very good. Sleep is often disturbed, so what we call sleep hygiene, in terms of changing our routines at sleep, making a regular routine for going to bed. People who stay up all night usually don't function too well the next day. And there are some things, and we sometimes use dream reprogramming or increasing the sleep pressure, especially if people are napping a lot and oversleeping. You want to consolidate the sleep, so you restrict that. Next slide, please. So that's what we have to say today. We're glad to have some discussion now. We really thank you for your attention and interest, and we wanted to thank our colleagues who have supported our research and at the IWK and the Center for Mental and Psychological Health and at Dalhousie University, and all of our colleagues around the world who have been engaged in our research and our discussions about grief and other situations. So keep in touch. This is the Ontario Caregiver, and will now be open for questions and answers.
Great. Thank you so much, Dr. McGrath, and to Brianne for sharing some beautiful information. We've had a very active chat box, so let's turn to some comments and questions that have come through before we wrap up for today. And folks, please throw those questions into the chat and we'll do our best to get to them. And some of you have asked about the recording and their slides and the resources, and we will be sharing that out to all of you post a few days from now. We're going to polish it up and send it out in an email. So you will get the slides and the recording and any resources as well. So lots of great chat box comments and activity. And I want to thank everybody for sharing. It's not easy to talk about your stories, especially when we're talking about grief and loss. And it's so wonderful to see so many folks in the chat box sharing their experiences and talking about what worked for them and just sharing with each other. So one of the questions or comments, I should say, that came up a couple of times was around anticipatory grief. So in this instance, this person commented that it can go on for years when they're supporting a medically fragile child, for example. Another person commented around dementia or Alzheimer's diagnosis. And certainly I have these conversations with caregivers often when they get sort of struck with that diagnosis and their sort of persisting symptoms and change in condition. So I don't know if you have any comments on anticipatory grief or thoughts around folks that might be experiencing this right now in their caregiving experience.
Yes, well, you see, the thing is that's where I would go back to this two-process model. I'm grieving because my child has a chronic illness, a very severe chronic illness that's likely to take their life, and so I'm anticipating that. Or my wife has cancer, and I know it's terminal, and if I get stuck only in the grief, then I'm robbing myself and my child or wife of having the joy of forward-looking things. I can still, go for a walk on the waterfront, as I did many times with my wife, even at times in her wheelchair, because walking on the waterfront in Halifax, if anybody's not done it, they've missed one of the 7 wonders of the world, is a joy. And so that was a really important part of the tradition that we had. We had that tradition that we would do that. And so her condition changed. She was ill. She couldn't walk. So we went with her. I pushed her wheelchair. And we had the same joy that we had when we used to do that summer and winter in that. So we have to use that dual process model to help us say, okay, the grief is there, but I'm not going to only deal with that. I'm going to also look at things that I can do that bring me joy. The same thing with your thinking about it. You know, if we only think about the impending loss, then we're going to be more miserable than we have to be. Okay. But let's think about what things we can do, what things can we share. Some may be reminiscence, some may be future oriented, some may be very small things. That special meal that you prepare that is their favorite dish. And maybe they can't eat a lot of it, but they can eat a little bit of it. And you love making the presentation. And so that dual process model is what I think is very helpful in anticipatory grief. Brianne, do you have any comments?
Yes, yes. I think, like you said, kind of focusing on what we can do, and your story of, of course, you loved walking, and then it shifted to the wheelchair. So that's not uncommon with even Alzheimer's. Or dementia. We're going to see, they're not the same. My mother, my father, my spouse is not the same anymore. And yes, we can spend time focusing on what is different. But what about what's the same? Well, when I walk in the room, she always smiles. That's always the same. She used to do that. So we focus on those things, and that can help. So what can we do about it? And yes, going in a wheelchair, it's unfortunate. We have to, we'll take them in a wheelchair, but and they might not want to do that. They might be having, a struggle as well with the changes they're experiencing. But being able to kind of identify that and work with that, what we can do.
Yeah, those are great tips to try to keep us focused on the present, and acceptance of what our experience is. I think my caregiving experience supporting a partner, that anticipatory grief of what I thought it would be was not what I thought it would be when I was entering into that realm. So I think that's really helpful to focus on what you can do and what's there for you now. And I think sometimes it also links back to guilt. Caregivers, I feel guilty. A lot of us feel tremendous amounts of guilt for various reasons. And sometimes when we speak to that grief piece, and you're not wanting to let go of the grief, maybe someone has passed and you look back and say, I wish I would have. I should have, those shoulds that we impress upon ourselves as caregivers. Do you have any suggestions on folks that might be experiencing guilt married with their grief?
Yes, and that's very common and can be very debilitating. A little bit of guilt is okay. It can be a little spice and a flavor to our lives, and that's okay. It helps us a little bit. But when it comes in big doses, then we have to begin to think about how are we going to change that narrative? What are we going to change what we're saying to ourselves? Okay, I didn't recognize this, and maybe I should have brought him to the doctor sooner. Well, none of us is perfect, and we all make mistakes, and we only can do what we can do. And so I think oftentimes guilt is a form of perfectionism, that we are saying that, well, we had to be this way and do it absolutely right. And God damn it, if I didn't do it that way, I'm at fault. Well, that's not fair. And we have to be fair to ourselves as well as being fair in the situation. So if we indulge in guilt, we may be depriving the person that we're caring for from some of the joys that we could have now, or we may be depriving ourselves from the ability to move forward. I know when my wife was dying, she took my daughter aside and she said, now, you have to remember something. When I'm dying, as you know, and we talked about it very openly. She had ovarian cancer, and we went through all of the possible treatments, and it was quite clear at one time that it wasn't going to work. But she still had a number of months to live, and we were going to make sure that it was really good. But she took aside my daughter and said, now, when I die, your father's going to have girlfriends. Mika was amazed. My daughter was amazed. And she said, now, I want you to treat them well. Okay? I want you to treat them well, because he's going to have lady friends, and that's fine. And that was an immense liberation for my daughter so that she didn't have to feel upset or guilty that I might have a girlfriend after my wife died. So these types of things, you can't imagine the number of things that will come up, and you have to be open to them and allow yourself to change those narratives that just put you down. Change the story.
Yes.
And we can change the story, and we have to change the story if we're going to go on. That's what our person who's gone, that's what they would want. And that's what we have to think about.
It's often just very quickly here. I know there's so many questions coming in, but the guilt is inside. We're alone with it. And the more we become alone, the more that guilt eats away. And it's so important to talk to a friend, talk to a family member, talk it through. And like Patrick said, having his wife share those hard conversations, and oftentimes, we're going through these processes and not acknowledging what can we talk about, what do we need to know, those questions, and having those questions. My mother did a very similar thing, and she took us aside and said, your dad will date, and I am okay. I am not upset. Don't be upset. Of course, first time it happened, it was a shock and it was very difficult. But I could hear her. I could hear her if I allowed myself to hear her, and that guilt soon released, right? And I was able to talk about it.
Mm-hmm. Thank you. Thank you both for your wisdom and experience as professionals, but also for your sharing your personal experiences. I think for many of us, hearing that, we're not alone and we're all struggling with this, regardless of our professional backgrounds and experiences, it really helps round out the tips and strategies and the encouraging thoughts that you're sharing with folks. And there's a lot of great comments in here about how I needed to hear this. And thank you. And thanks for sharing this. I'm mindful of time, but I do want to jump into one other comment question that's come through in similar ways a couple of times around noticing others who maybe should be grieving. They're not showing that they're grieving. So a comment came in around, how would you encourage someone else to slow down? Their mother-in-law is always in busy mode and rarely sits down. And if she does, there's some sort of separation, isolation using phones and devices. And another comment around, like, what would you say to people who feel like they're keeping to themselves or keeping too busy to avoid the grief, or that they're not grieving enough? So it's sort of for ourselves as grievers, but also looking into the eyes and the lives of those that are going through loss, and maybe recognizing that folks might be avoiding this, or that's the perception.
Right. So the first thing is with kindness and understanding. And kindness is going to go a long way. We all have, if the mother-in-law is keeping too busy and doing things all the time so they can't think about anything, treat that with kindness. So it might be something as simple as saying, Mom, I know that it's hard to think about, your husband gone, but I do think about them, and it's okay if you do too sometimes. But you've been so good in helping the family deal with this, but it's also important for you to think about it once in a while, maybe, and in your own way. And anything I can do to help, let me know. It's not helpful to tell somebody that they're not grieving right.
Right. Because there is no right way. And understanding that it will be different. Yeah.
And yes, and people may do things that we think are not going to be helpful. That's their choice. And what we should do is treat them with kindness. We can still say it in a kind way that, I found that when I was dealing with this, that I found it helpful to talk about it, but not with the implication that you must do it. There's no, the shoulds have to be just tempered, taken out of it. Everybody has their own way. And I think if we think of how can I be kind to my friend or my parent or my relative, how can I be kind to them and supportive of them, supportive of their way, then that's good. For some people, it will be different and you don't understand it, even asking. I don't quite understand what's happening because I know that you're sad but you look so happy all the time. And just listen, not tell them what they should do. Just listen.
Mm-hmm. And it can also come out then later, right? And so understanding that that's okay. And when it does happen, to be there for them, but also be there for them as they journey on their grief process. And it will not look the same, or it might not look the same. And that's okay. Yeah.
Yeah. We all grieve differently. We all have our own process and our own approach. And I really appreciate the messaging around kindness and support, and asking questions. I think this presentation and information is so important because grief and loss is so difficult for many to talk about. And all of your information and strategies have really given folks some ways of opening up that conversation a little bit more. And I think that's so important. So thank you. We are at time, but I do want to thank you, Brianne and Dr. McGrath, for sharing your personal experiences as caregivers and your experience with grief and loss, and for all the wonderful insights and tools that you've given to all of us today during different stages of grief. So this can be a really difficult subject to talk about, but so important to acknowledge and support folks at their different stages of caregiving. So I want to thank you both for joining us today.
Well, thank you.
Thank you. Yes. Thank you for having us.